12:18 p.m. The trauma bay was quiet in the way it only gets when medicine has run out of options. Monitors blinked, oxygen levels drifted lower, 1 decimal point at a time. On the table lay a Navy SEAL, unconscious, intubated, his body failing in a pattern that didn't belong to any chart on the wall. The senior physicians had already done what protocol allowed, every approved intervention, every safe step. Now they were watching the clock. In the corner stood a rookie nurse, silent, unnoticed. She wasn't watching the doctors. She was watching the timing. When the oxygen dipped again, she spoke, quietly, without urgency. This decline isn't following a hospital curve. A few heads turned, not in disbelief, in recognition. If we treat this the standard way, she continued, measured and precise, he doesn't come back. Then she named the technique, not something taught in medical school, not something written into civilian protocol, a method learned in places where hesitation costs lives. The room went still, because everyone understood what she had just implied. If she was wrong, her career would end in that room. If she was right, the SEAL wouldn't survive the hour unless they acted now. Stay with this story, because the reason she knew that technique was never meant to surface again. Before we begin, take a moment to comment where you're watching from and subscribe. These stories exist because people choose to stay with them. 12:18 p.m. wasn't dramatic on the surface. It was bright outside, the kind of midday light that made everything feel manageable, routine, safe. Inside the trauma bay, the air was cool and controlled, voices low, movements precise. No shouting, no running. Just the steady rhythm of machines doing their jobs. The Navy SEAL on the table wasn't bleeding out. That was the problem. He was unconscious, intubated, chest rising mechanically with each assisted breath. His vitals hovered in a narrow band that looked acceptable if you didn't watch long enough. Heart rate steady, blood pressure holding, oxygen saturation just high enough to avoid alarms, until it wasn't. The monitor dipped by 1 point. Then another. A respiratory therapist adjusted the ventilator settings. A senior physician glanced at the screen, then away, like someone checking a clock they already knew was against them. No one panicked. Panic was for obvious failures. This wasn't obvious. "This isn't hypoxia from trauma," one doctor murmured. "Lungs are clear." "ABGs are drifting," another replied, "but not fast enough to explain this." The SEAL's body was failing quietly, in increments so small you had to commit to watching them to notice. And they were watching, all of them. A dozen trained eyes, each measuring, recalculating, waiting for something to declare itself. In the corner of the room stood a rookie nurse. Her badge was new enough that it hadn't softened at the edges. Her scrubs fit a little loose, sleeves rolled once at the wrists. Blonde hair pulled back neatly, no stray strands, no nervous habits. She wasn't holding a clipboard. She wasn't checking medications. She stood still, hands relaxed at her sides, eyes fixed on the monitor. No one had assigned her there. No one had told her to leave. Another dip, oxygen down again. Just a fraction. Enough to register, not enough to justify action. "Let's prepare for supportive measures," the lead physician said quietly. "If he continues this trajectory, we stabilize and reassess." It was the language doctors used when rescue was slipping out of reach, but hadn't officially left the room yet. End-of-life stabilization without saying the words, comfort without surrender. Everyone understood what it meant. The rookie nurse shifted her weight almost imperceptibly. She wasn't watching the doctors. She was watching the timing. She counted in her head without moving her lips. The intervals between dips. The delay between intervention and response. The way the oxygen dropped not when expected, but just after. A lag that didn't belong. When the monitor dipped again, she spoke. "This decline isn't following a hospital curve." Her voice wasn't loud. It didn't interrupt. It didn't ask permission. It simply existed in the space, calm and precise. A resident glanced over reflexively, then looked back at the screen. Another doctor paused mid-note. No one laughed. No one snapped at her to stay in her lane. The room didn't reject the sentence. It absorbed it. "What do you mean?" the respiratory therapist asked, careful, neutral. "If we treat this the standard way," the nurse continued, eyes still on the monitor, "he doesn't come back." That did it. The lead physician turned toward her fully for the first time. Not annoyed, not dismissive. Uneasy. "Explain," he said. She took one step closer to the bed, still not touching anything. The oxygen drops aren't primary, they're secondary to a pressure mismatch. You're chasing the symptom, not the timing. A few glances were exchanged. This wasn't nonsense. It also wasn't something you heard in civilian training. "We're already supporting him," the physician said. "What are you suggesting?" She hesitated for a fraction of a second. Not fear, calculation. Then she named the technique, not loudly, not dramatically, just the name, spoken like a fact. The room went very still. One doctor inhaled sharply through his nose. Another looked down at the floor, then back at the patient. The resident's face tightened, not in confusion, but recognition. "That's not—" someone started, then stopped. The lead physician didn't speak right away. He looked at the clock on the wall. 12:21 p.m., then back at the monitor. Another small dip, right on schedule. "If you're right," he said slowly, "we've missed the window." "Not yet," she replied, "but we will." The silence stretched. No one challenged her credentials. No one asked where she learned it. They all understood the same thing at the same time. If she was wrong, she'd violated protocol in front of everyone. If she was right, waiting would kill him. "Why hasn't this presented sooner?" the physician asked. "Because his body's compensating," she said. "It won't keep doing that." Another dip. Faster this time. A nurse at the foot of the bed whispered, "We're losing him." The rookie nurse didn't look at her. "Not yet," she said quietly. The physician exhaled through his teeth. "If we attempt this," he said, choosing his words carefully, "we commit. There's no partial." She nodded once. "I know." "And you're confident." She didn't say yes, she said, "I've seen this exact pattern before." That was the first moment someone noticed the way she stood. Straight, balanced, like she was used to rooms where hesitation cost more than mistakes, like she was waiting for a decision she'd already accepted either way. "Prepare the bay," the physician said finally, "but we don't proceed without consensus." Another oxygen dip. Sharper. The resident looked up. "We don't have time for consensus." The room felt smaller suddenly. The midday light through the window seemed irrelevant now, like a lie from another world. The rookie nurse stepped back half a pace, giving the physician space. She didn't argue. She didn't push. She had already said what needed saying. The physician looked at her again, really looked. At her steady hands, at the absence of fear in her face, at the fact that she hadn't once mentioned herself. "If we do this," he said slowly, "we don't come back." No one said yes out loud. That was the first strange thing. The lead physician didn't give a clear order. The resident didn't object. The respiratory therapist didn't move away from the ventilator. They all stood in a narrow space between action and consequence, staring at the same numbers, listening to the same quiet alarms that hadn't triggered yet, but were close enough to feel. The rookie nurse remained where she was. She didn't step forward like someone claiming authority. She shifted slightly to the side, creating space, the way people do when they expect to be included without asking. Her hands stayed visible, open, calm. Another oxygen dip. This one lasted longer. The physician glanced at the clock again. "Positioning," he said, not looking at anyone in particular. "Let's start there." It wasn't the technique yet. It was the prelude, the part that felt safe enough to justify moving. The nurse spoke immediately, not louder, not sharper, just timely. "Rotate him 5 degrees to the left first, then wait." The resident frowned. "That's not standard for—" "Wait," the physician repeated, holding up a hand. They adjusted the bed. The SEAL's body shifted slightly, tubes and lines moving with practiced care. Everyone watched the monitor. Nothing happened. For 3 seconds. Then the oxygen stabilized, not improved. Stabilized. The respiratory therapist's eyebrows lifted. That shouldn't have done anything. The nurse didn't react. She was watching the waveform now, not the number. The shape mattered more than the value. "Timing," she said quietly. "It'll hold for about 20 seconds. At 17 seconds, the oxygen dipped again. The room collectively inhaled. The physician turned toward her. "What's next?" She answered without hesitation. "Elevation, 2 centimeters, no more." They did it. This time, the stabilization lasted longer. The resident swallowed. "How are you predicting that?" She didn't answer the question directly. "Because he's compensating from the inside out," she said. Once that fails, everything drops at once. That was the second hook tightening around the room, the sense that she wasn't guessing, she was anticipating. The physician nodded slowly. All right, he said. We continue. They didn't announce it, but everyone understood. They were following her now, not because she asked, because the patient was responding. The nurse never took a central position. She stayed just off to the side, redirecting instead of commanding. Not yet. Hold there. Now. Her words were short, functional, no wasted language. Another improvement, slight, enough to raise hope and make it dangerous. The SEAL's heart rate steadied. Blood pressure ticked up by 2 points. Someone exhaled. Too early. The nurse's eyes narrowed. This is the false peak, she said. The resident looked at her sharply. What does that mean? It means this is where most people stop, she replied. And that's when it collapses. As if on cue, the monitor stuttered, then dropped. Harder than before. Alarms chirped, not screaming yet, but louder now, insistent. Pressure's falling, the respiratory therapist said. SpO2 down 5, the resident added. The physician swore under his breath. We're losing ground. A nurse at the door said what everyone was thinking. Should we stop? The rookie nurse shook her head once. No. It wasn't defiant. It wasn't emotional. It was certain. This is the drop I was waiting for, she said. If we stop now, he doesn't recover. The physician stared at the monitor, then at her. And if we continue? She didn't answer immediately. That pause mattered. Because it wasn't uncertainty. It was respect for the cost. If we continue, she said finally, we commit to the full sequence. And the risk, she met his eyes, is exactly what you think it is. The room felt heavy now. Not chaotic, pressurized, like something sealed too tightly. The physician nodded once. Proceed. The nurse adjusted her stance subtly. Feet planted, shoulders squared. A posture no one commented on, but everyone noticed. Sequence, she said. Not speed. They moved in sync now. Elevation, vent adjustment, timing each step to the monitor, not the clock. The SEAL's oxygen climbed, then held for 10 seconds, then 15. A fragile thread of hope stretched across the room. Pulse is improving, the resident said. The nurse didn't smile. She was watching something else. Wait, she said. The physician's jaw tightened. We're gaining ground. Yes, she replied. Which is why the next drop will be worse. As if the body resented being forced back into balance, the numbers crashed. The alarms screamed this time. Heart rate spiked, then plummeted. Oxygen free fell. The resident froze. We're out of window. The physician looked at the nurse. We have to abort. No, she said calmly. This is it. What do you mean, this is it? The physician demanded. She stepped closer to the bed for the first time, not touching, just close enough to feel the heat of the patient's skin. This is the point where civilian protocol fails, she said, because it assumes the body will respond the same way twice. The resident shook his head. You're saying we push through a crash? I'm saying we don't treat this crash, she replied. We use it. Silence slammed into the room. The physician stared at her. That's irreversible. Yes. And you're sure? She didn't say yes. She said, I've only ever seen this pattern end one of 2 ways. And the other? She looked at the SEAL. The other requires doing nothing for 3 seconds. 3 seconds. In medicine, 3 seconds was an eternity. You want us to stand here, the physician said slowly, and watch him die? No, she said. I want you to let his body finish what it started. The alarm screamed. The resident's hands hovered uselessly over the crash cart. We can't just... 3, the nurse said quietly. 2. The physician's eyes flicked to the clock. 1. The monitor flatlined. Not a dramatic code blue, just a flat, merciless line. And then the SEAL's body reacted. A sharp, involuntary breath pulled against the ventilator. The waveform jumped. Oxygen surged back in a jagged spike. The line wavered, then stabilized. The room didn't cheer. They didn't speak at all. The physician stared at the monitor like he didn't trust it. Get me a pulse, the resident checked. His voice shook. It's there. The nurse stepped back again, returning to the edge of the room as if she'd never moved. The SEAL's vitals steadied into something fragile but real. The physician exhaled a breath he hadn't realized he was holding. What did we just do? The nurse looked at the monitor one last time. We gave him a chance. The room slowly came back to life. Quiet orders, adjustments, documentation that would never fully explain what happened. The physician turned to her. That technique, he said. Where did you learn it? She didn't answer right away. I need to know, he pressed. Because if anyone asks, she met his gaze, it won't be in the chart. That was all she said. Before he could respond, the SEAL's hand twitched. Barely, but enough. The nurse noticed immediately. She leaned in slightly, her voice low. He's coming back. The physician looked at the patient, then at her. Who are you? She didn't answer that either. Not yet. If you believe we should never judge the quiet ones, comment never judge. The room stayed frozen long after the monitors settled. No one trusted the silence yet. The SEAL's chest rose and fell with the ventilator. Slower now, steadier. Color crept back into his face in uneven patches, like a body relearning itself. The alarms had quieted, but no one moved away from the bed. Experience had taught them better than to celebrate early. The rookie nurse stood exactly where she'd retreated, near the wall, hands relaxed, gaze steady. She didn't look relieved. She didn't look proud. She looked alert, like someone waiting for the next phase of a fight they knew wasn't over. The lead physician broke the silence first. Reduce vent support by 10%, he said carefully, testing the moment. The respiratory therapist complied. The numbers held. A murmur rippled through the room. Not excitement, respect. The kind that crept in when outcomes forced people to reassess what they thought they knew. He's stabilizing, the resident said, quieter than before. The nurse nodded once. For now. That qualifier landed heavily. As if summoned by her words, the SEAL stirred. It started with his fingers. A subtle curl, then a release. Not reflexive. Intentional. The resident leaned closer. He's waking up. The physician felt his pulse jump. Lighten sedation. They waited. The SEAL's eyelids fluttered. Once, twice, then opened. The room seemed to shrink around that moment. His eyes were unfocused at first, glassy, struggling to anchor. Then they sharpened. He scanned the ceiling, the lights, the unfamiliar shapes leaning over him. And then his gaze found her. The rookie nurse. Everything else fell away. His breathing changed, not faster, controlled, deliberate. The kind of control that came from habit, not comfort. She felt it instantly. Not because he looked at her, because of how. She took a small step forward, cautious now. You're in a hospital, she said softly. You're safe. His eyes never left her face. Ma'am, he rasped. The word cut through the room. The physician stiffened. The resident frowned. No one corrected him. The SEAL tried to lift his arm, the one not restrained. His movement was weak, shaking but precise. Before anyone could stop him, he brought his hand up and saluted. It wasn't dramatic. It wasn't sharp. It was exact. The room went dead silent. No one breathed. The nurse froze. For the first time since she'd spoken, since she'd guided them through something no one else could see, her composure cracked. Just slightly. Just enough. Don't, she whispered. You shouldn't move. He held the salute anyway, hand trembling with effort. You said you'd find me, he said hoarsely. Didn't think it'd be here. The resident's mouth fell open. Do you know him? The physician didn't answer. He was staring at the nurse. She lowered the SEAL's arm gently, with practiced care. You're confused, she said, but her voice lacked conviction. No, he replied. You pulled me out of Kandahar, left side breach, night rotation. You told me not to look back. Her jaw tightened. That wasn't me, she said. He smiled faintly. You always say that. The weight in the room shifted. Something unspoken surfaced, thick and undeniable. The physician cleared his throat. Sir, he said carefully, you've been through significant trauma. You may be experiencing... Doc, the SEAL interrupted, eyes still locked on her. If she says I'm breathing, I'm breathing. If she says I'm dying, you better start running. No one laughed. The nurse straightened slowly. You need to rest, she said. You survived. That's enough for today. Because of you, he replied. She looked away. That was the second hook tightening. Recognition without confirmation. The physician stepped closer. He said Kandahar. She didn't respond. You named a technique earlier, he continued. One I've only heard discussed in classified briefings. Still nothing. The resident whispered, She's not just a nurse. The nurse finally spoke, her voice low. You need to focus on your patient. I am, the physician said, and I'm trying to understand how. Before she could answer, the doors to the trauma bay opened quietly, not rushed, not chaotic. Two men in plain clothes entered. Their posture gave them away instantly, military, even without uniforms. Calm, purposeful, eyes scanning, not searching. Behind them, security hovered, unsure whether to intervene. The taller man glanced at the monitors, then at the seal. Satisfied, then he looked at her and stopped. The room felt the shift before anyone understood it. The man took one step forward, then another. He raised his hand and saluted. This one was crisp, full, unmistakable. Ma'am, he said, we were told you were dead. The nurse closed her eyes. The physician exhaled slowly. Who are you? The man lowered his salute. Someone who's been reading the wrong report for a long time. He turned slightly so the room could see him fully. Forward medical command. The resident's stomach dropped. You can't be here, the nurse said quietly. And yet, the man replied, here you are. The SEAL watched the exchange with grim clarity. They finally found you. She opened her eyes. I didn't disappear, she said. I was removed. The man nodded. After the incident. The word hung in the air like a loaded weapon. What incident? The physician asked. She didn't answer him. The man did. A decision made under fire. A call that saved a platoon and cost a career. The nurse's hands curled into fists at her sides. You don't get to summarize it, she said. The man softened slightly. You're right. But they deserve to know who just kept that man alive. She looked at the SEAL. He met her gaze steadily. You told me once, he said, that sometimes saving the mission means someone doesn't make it. The room felt smaller again. That wasn't your burden to carry, she said. You carried it anyway, he replied. The physician stepped back, the full picture crashing into place. You're military, she nodded once. A combat medic? The resident asked. Her expression tightened. Surgeon. The word landed hard. The man in plain clothes glanced at the monitors again. He shouldn't be alive, he said calmly. Not by civilian metrics. She didn't argue. That technique, the physician said slowly, you used it before. Yes. In combat. Yes. The room reeled with it. The nurse, no, the surgeon, took a breath. I didn't come here to be recognized. And yet, the man said, you stepped forward. She looked at the SEAL, at the steady rise of his chest. I always do, she replied. An alarm chirped softly. Not his vitals. A new alert. The respiratory therapist frowned. Pressure's shifting again. The nurse turned instantly, all hesitation gone. She moved back to the bedside. This isn't rebound, she said, scanning the monitor. This is interference. The physician stiffened. Interference how? She didn't answer. She lifted the edge of the dressing and froze. A suture she hadn't placed stared back at her. Clean, deliberate, wrong. Her blood went cold. Lock this room, she said quietly. The man in plain clothes reacted instantly, signaling to security. The nurse looked up slowly. Someone here knows exactly what I did, she said. And they're trying to undo it. She straightened, eyes hard now. And that means, she finished, this isn't over. The SEAL's monitor spiked sharply, and somewhere in the hospital, a door clicked shut. The lock engaged with a dull mechanical click. It wasn't loud, but everyone in the room felt it. The kind of sound that told you decisions had already been made somewhere above your pay grade. The nurse, no, the surgeon, was already moving. She didn't raise her voice. She didn't look at the men in plain clothes. Her focus narrowed to the SEAL, to the numbers that were shifting again in a way that didn't belong. Pressure isn't rebounding, she said calmly. It's being redirected. The physician stepped closer, his earlier authority now replaced by something quieter and sharper. Trust. You're saying someone interfered. I'm saying someone closed a path I opened, she replied. On purpose. The resident swallowed. Who here would even know how? She didn't answer immediately, because there was only one answer, and saying it out loud would change everything. The SEAL's breathing hitched. His hand tightened weakly against the sheet. She was at his side instantly, gloved fingers finding his wrist. Stay with me, she said, her voice lower now, almost personal. You're not going anywhere. His eyes flicked to her. You always say that, he murmured. And you always listen, she replied. The monitor dipped again, sharp this time. The physician didn't wait for permission. Open the dressing! She peeled it back, exposing the area she'd stabilized earlier. The suture was still there, tighter now. Someone had reinforced it. That'll choke the vessel completely, the resident whispered. Why would anyone? Because they don't want him alive, she said. That was the first turn of the knife. The man from Forward Medical Command stepped forward. This wasn't an accident, he said quietly. We pulled access logs. Someone with clearance entered recovery during the transfer. The physician's jaw tightened. You're telling me this hospital's compromised? I'm telling you, the man replied. This patient isn't the target. All eyes shifted to her. She didn't flinch. They're testing the outcome, she said. Same way they did back then. The physician frowned. Back when? She looked at him fully now. The mission they erased? Silence pressed in. She cut the reinforced suture cleanly, hands steady, despite the pressure screaming back into the room. Blood flow surged again, but uneven, chaotic. Clamp, she ordered. No one hesitated. The second hook tightened, the realization that this wasn't just medicine anymore. This was unfinished business. His body's reacting differently now, the resident said. It's not following the earlier pattern. Because he remembers, she replied. Trauma does that. It rewrites the response. The physician watched her work, awe and unease tangling together. You're adapting in real time. She nodded once. That's how we survived. The SEAL's oxygen stabilized again, but his heart rate climbed dangerously. The monitor screamed its warning. This is the last window, the physician said. If we don't... I know, she interrupted gently. I was there when this happened the first time. She paused, then made the call. Not the safe one, the right one. Reduce support, she said. Now. The resident stared at her. That'll drop him. Yes, she said, so it can come back stronger. The physician hesitated, then nodded. They reduced support. The numbers fell. Fast. The SEAL's chest strained against the ventilator. His hand twitched, then stilled. For a heartbeat too long, nothing happened. The room held its breath. Then his body surged. A violent inhale, a sharp spike, oxygen rebounding hard, stabilizing higher than it ever had before. The monitor settled into a rhythm that felt right. The resident laughed weakly, disbelief breaking through fear. He's stabilizing. The physician closed his eyes briefly. You did it. She didn't answer. She was watching the SEAL. His eyes opened again, clearer this time. He focused on her face, really seeing her now. You made the same call, he whispered. Didn't you? She nodded once. And it worked this time, he said. It always worked, she replied softly. They just didn't like the cost. The man from command stepped closer. We buried that decision, he said. Called it failure, called you unstable. She met his gaze without anger. And how many survived because of it? He didn't answer. He didn't need to. You didn't fail, the physician said quietly. You were right. That was the third turn, the one that hurt the most. The command officer cleared his throat. Federal review's already underway. Your record will be corrected. She shook her head. I didn't come back for that. We know, he said. That's why we're asking you to stay. The physician looked at her. Veteran trauma unit, lead position, your protocols, your judgment. She glanced at the SEAL, at the steady monitor, at the room that had changed around her without realizing it. I don't want a rank, she said. Then don't take one, the physician replied. Just don't disappear again. She thought of the years she'd spent quiet, invisible, safe, then of the moment she stepped forward. I won't, she said. The seal smiled faintly. Knew you wouldn't. Hours later, the trauma bay returned to routine. Charts filed, floors cleaned, stories whispered. But something had shifted. Doctors glanced toward her instinctively now, not because she demanded it, because they trusted it. She moved through the halls the same way she always had. Calm, unassuming, quiet, still a professional, still underestimated by anyone who didn't know better. Before she left for the night, the seal caught her hand briefly. You saved my life, she squeezed once. That's the job. No, he said, that's who you are. She walked out into the daylight she'd entered hours earlier, unchanged on the surface, but no longer invisible. If you stayed with this story, if you felt the weight of restraint, of quiet strength, of the ones we overlook, please subscribe. I'm not asking lightly. Stories like this don't survive on noise. They survive because people choose to stay, to listen, to believe that the quiet ones matter. If this moved you even a little, stay with us.